Dr. Edward Arana, who has been a mentor to all of us. He got interested in alternative medicine and dentistry back in the late 70s. He studied electroacupuncture with Dr. Voll. He traveled to Germany and parts of Europe to learn from the best of the best in that part of the world. He introduced me to Dr. Klinghardt in the late 80s, early 90s. He had me speak at an American Academy of Biological lecture back in the early 90s, and it's kind of like being on the Johnny Carson show. He gave me my big break. So, without further ado, I want to introduce Dr. Arana, and we're going to play a little song here, right? All right, you take the podium here. I want to say a couple other things. You know, Dr. Arana had the stroke this summer, and he was, I think, in part precipitated to a great extent by the hounding by the boards of California for doing things that are biological, if you will. And I think that the stress caused his demise as far as a stroke, and I'm sure it caused Dr. Allender's demise and his death. So, Edward.
Thank you, Chris. Can everybody hear me okay? Yep. Okay, well, if you can't, just wave or something. First of all, I want to thank each and every one of you for coming, because without you, we wouldn't have this meeting, or we wouldn't have the opportunity to get together and plan our futures while we still can. The way the board or any governmental bureaucracy is trying to gain control, what they created, in my instance, is they created something akin to the dental Gestapo by going after me on what I had written to a patient, which was a confidential, you might say, memorandum about her particular problem, on how I felt she should resolve it. I come to find out later, in the last few months, I think it was maybe in Reader's Digest, and we'll talk about that in a little bit. Reader's Digest, lost my train of thought.
The article in Reader's Digest about dentists.
Yeah, about we find out now that dentistry is both an art and a science, so it's okay to have an individual, not a scientific, quote-unquote, interpretation of what you're doing, but an artistic one, where there's a lot of latitude for doing certain things in aesthetic ways, or non-aesthetic ways, or comfort ways, or whatever. You can be a functional, comfort, aesthetic, bondodontist. You can be all of these things. We even had one category, which was a very short-lived category, by one of our members out on the Massachusetts, on the East Coast, and he became a oncodontist. Very short-lived species. He was looking at cancer, what's happening in and around the teeth, and he was looking at that, and he was making some wonderful observations. This is where we should be in relationship to cancer in the teeth, not something talked about 90 years ago. What I'd like each and everyone to do is to stand up and to kind of just stretch your arms out so that you have your space delimited. And then I want you to pick a person next to you and give them a little hug and thank them. And at the same time, thank them. All right, I just did a little hug. And I want you to thank these people. Is this thing on?
Yeah.
We want you to thank these people for, let's say, taking the ball on detox and running with it. We certainly appreciate everyone's selection to be here, because you wouldn't be part of this effort unless you really wanted to be. And I appreciate that. So you thank the person next to you for their part in bringing better dental medicine to their patients through knowledge. And we of IABD certainly want to thank you for the opportunity to bring you more information that will make you a better doctor, better healer on a scale that's not too unfamiliar, that you're too familiar with. We're not completely finished with what we started here on this heavy metal detox. That'll go on for quite some time. And we introduced a new tool to you today, the electrical ionophoretic direct current application of silver ions to wounds and infections, and its unique ability to regenerate tissue, heal wounds, stimulate bone growth, make things septic, and I think that's what it does. And as I said, it stimulates bone growth and healing. We will have more courses given on the nitty-gritty of this over a period of time. I can see that there's a lot of amazement still on the faces of people. In other words, it's not clicking over on how they can actually do this. But the next course we have on it, we'll have it so that you can purchase the generators and the cloth and the electrode leads, so you can actually gear up and start working in and around the mouth to do this particular thing. And as we get more and more people online using it for simple things in and around the mouth, then we can make the determinations whether or not we're able to affect focus with what we got, or maybe we'll have to have different combinations of injectable medicaments, such as the sauna materials and or simple ones like homeopathic materials. I think we can take and pretty much use just about anything with the interosseous injections that we didn't go into in this particular seminar, but we plan to go into that when we get some more and more evidence accumulated that it's beneficial, and what to use. Some isopathic preparations that are made by certain German companies seem ideal for this situation. We also have medicaments that we can use to stimulate the cleaning up of the tissues of the jaws. And I myself have been using electricity in treating wounds, not with silver. I tried with silver, but I was using colloidal silver, and that was too weak and not the right size particle. And after 12 about half-hour treatments, You can compare the X-ray with one with another, and you can see that one is definitely denser, but it didn't do exactly what I had thought it would do. So I kind of let that go, and then Bart told me that I was doing it wrong. Who am I to argue with him?
True.
I said, show me the money. Oh, okay. As a little added entertainment, what I planned on doing was rededicating to you all, you uncommon physicians, dentists, acupuncturists, chiropractors, physical therapists. You know who you are. You're all sitting out here. Dentists, physicians, chiropractic physicians. I want to rededicate Aaron Copland's fanfare to the common man, but we want to dedicate it to you, the uncommon physician, dentist, and well, would you turn that box on? That's good, everyone can hear it. Wake you up this afternoon a little bit. You won't forget this one. He wrote this music for the common man, and by his thinking was he meant the taxpayer. So I don't, as a sovereign, I don't want to have anything to do with that. So what I want you to do, I want you to continue to be uncommon doctors and people and persons, but I want you to start to use your head and help everybody out. I got that thing humming now. Give it an amp or two. It's got a little volume knob on the side.
Louder? Yeah.
Yeah. I'm sure that Aaron, if he was here, he would agree with us that the music's not only fitting for the common man, but for the uncommon doctor too. Give us a couple of amps on that. Thank you. Thank you very much for the applause. I certainly want you to continue in your ways and bring the things that we've found to be useful into your practice so you can help your patient. I think this is really important. I think that in allopathic medicine, they've forgotten the patient. Can you imagine a nice fellow like myself, unconscious after having a stroke, and as I'm leaving the hospital, I'm actually raising one of my fingers to those doctors.
I was a witness.
I felt kind of bad about it after, because they were really trying to help me in their limited ways. And I was unable to help myself at the time. So, anyway.
You want to introduce Dr. Issels now?
Yeah. What I'd like to do is I'd like to introduce Carol. Where's the diploma of recognition. Do you have it? Do you have the diploma? Yeah, thank you. We have made a diploma of recognition for Dr. Issels and all the things that he's done. In your handout material, you'll see a translation of the head focus and what it means. And can you imagine how this affects the treatment of cancer? They not only will be upset about this information getting out, but they will probably also try to kill you. I mean, the only other place that they're that rough is in the energy game. And in the energy game, in the medicine game, as a physician or a dentist, they'll try to ruin you and make you drive you to the poorhouse and take your license away and besmirch your reputation. That's what they do. But in medicine, they might try to facilitate your demise. Oh. You go.
Okay, just some final words about Ed that I think are important for you guys to know before we go really on to Dr. Issels. Is Ed and I spent a vacation in Germany where I took him to my hometown, Berlin, and we wanted to save some money, so we wanted to sleep with 2 beds in the same room. And what we found was a queen-size bed that we had to share with each other. And I had my earplugs with me, which was good. But the next morning, we were the only guests in that hotel, which was in a forested area, about 200 yards from the hospital where I was born and 500 yards from the house where I grew up. And the next morning when we came to the breakfast table, we noticed that nobody would engage in any conversation with us. And later I found out that all the employees in the hotel thought that we were in a sexually active relationship with each other. And ever since then, Ed and I were very close friends. It was on the same vacation where we went to a cafe in Berlin, where we both had a piece of cake or something. And at the end of as we were paying our bill, the rather attractive-looking waitress, came up to me and whispered in my ear, for an American, you really speak German well. That was our trip to Germany. I want to say a few more things about Ed's health, because we want to have things out in the open so we can all learn from it. Ed had fibrillation of the atrium of the heart, which is a fast flicker, uncoordinated heartbeat, which is a known complication of mercury toxicity in dentists. Then he had a stroke, which is a known complication from atrial fibrillation, but is also a known complication for mercury toxicity in dentists. And a stroke is also a known complication from stress. So one of the things we can take home, from knowing Ed and this kind of looking at him also as one of our leaders, we want to learn from him what to do and also what not to do. Unfortunately, Ed wasn't benefited, by the mercury detox, which we started way too late. And the whole knowledge that we have now about how to safely practice dentistry wasn't around when Ed started taking out amalgam fillings. He saved a lot of people's lives, but it was obviously too late, to stay healthy, for him. And so we've learned a lot regarding safe dentistry. Please practice it. All of you who practice dentistry, please use all the precautions that we have. Please use the mercury detox program, or the different ones that we have. I'm not claiming we have one has a better one than the other. Everyone has different ideas, but all of them work to a large degree. And like Ed said before, we don't have a perfect program yet, but we're getting very close to it. Please practice that. And foremost, please keep the stress level low that you have. Don't attend too many seminars. And be intelligent around the issues with the dental boards and the medical boards. I've been going through a medical board thing. Yes, if you stay and fight, many of us win the cases. Ed came successful out of his case. I came successful out of mine. Many friends came successful out of their cases, but it takes years of your life. And if you can avoid it, be intelligent about how you're marketing yourself, how you're practicing, how you're doing things. Ed, is there anything any wise words from you that you want to add to this?
Thank you for your effort on let's say the first half. So let's get out there in the second half and let's win for the alma mater. Be true to your school,
Yeah. Okay.
It's not over until a fat lady sings.
Okay, now let's bring the focus to Dr. Issels. Let me introduce Dr. Issels from what I know about him. I know that when I lived in Germany, the word Dr. Issels was always treated with a great level of reverence that the Germans usually do not have for their own teachers. Usually when you're a teacher in Germany, you get bad-mouthed, you get backstabbed, just like here and everywhere else in the world. But not so Dr. Issels. There's a few teachers that have been so way above everybody that they stayed largely unstabbed and uncontaminated and just were simply considered as heroes, just on the level of an Albert Einstein or any of the other folks that we had over there or over in this country. Dr. Issels was a very close personal friend and affiliate with the Honecker brothers. And actually, as I found out, was doing locums in the practice of Dr. Honecker when Dr. Honecker was writing his first textbook on neural therapy. And Dr. Issels was the first one who really had a consistent, holistic program of decontaminating patients in terms of their focal illnesses that they had, the interference fields such as scars, infections such as the sinuses or tonsils or teeth. And he did this work that I've been trying to teach you guys, that Ed has been trying to teach. Many of you have been my teachers and teaching me. This work Dr. Issels did to a much finer degree than we do today already in 1938. And he went on from there, he didn't stay there. So pretty much everybody who knows kind of what I've been teaching is on the level where Dr. Issels was in 1938. And this man hasn't stood still in the last 50 or so years. He had his first large cancer clinic in early 1950 in Bavaria, which has become sort of the standard for all the alternative cancer treatment programs all over the world. If you go to Mexico now, to any of the cancer clinics, if you go to anywhere in Europe, anywhere in Asia, the ones that I know of, they're all offshoots of what Dr. Issels has created in the 50s, 60s, 70s. One of the things that stand out from a neurotherapy point of view was this meticulous work with cleaning up the tonsil area, not just by taking the tonsils out, but by operating and reoperating and reoperating until every bit of infection was out of the area. The dramatic results on cancer, cleaning up the teeth, the dramatic results in cancer. He started the immunotherapy, taking cancer cells from the tumor that was excised and basically making them into homeopathics, giving them the patient again, using his own cancer tissue, turning the frequency around and giving it to the patient as a type of immunotherapy that is now only emerging as one of the leading treatments in cancer, with a lot of research in the allopathic community being done. I could go on with the list. He's written 3 books on cancer. which have been very much a guideline to me and other physicians in this country of what to do. And basically anything you know about alternative cancer treatments, he's written about already. In his, one of his first books was in '53, and then another one in '75. And I really haven't seen anything new in cancer therapy he hasn't written on already by 1975. So really with that in mind, I want to ask Dr. Issels to come up here, and we're going to present, Ed is going to present him an award. We give it to him, to the master. Give him a round of applause. Dr. Issels, by the way, is turning 90 in just a few weeks.
Yes, thank you very much. Yes, the people that say that IABD is nothing but a diploma mill can stand assured that we are. We have this in the computer now. Let go.
So, thank you very much, Dr. Arana, not for only inviting me for this application. And I hope that we can work together a long time. I'm old, but I hope that I live something longer, that we can work together. Now we find a very good.
You notice that we have the blue and white ribbon of Bavaria here under the seal of the American Academy of Biological Dentistry. We didn't mean to put it underneath our seal, but we wanted you to know that this titanic struggle between good and evil did occur in Bavaria. Okay, you may be unaware of it, but it happened, and it's not over yet. Okay.
Dr. Issels, you want to say a few things?
Bitte?
You want to say, wollen Sie ein paar Sachen sagen?
Ja.
Du kannst auch auf Deutsch.
Ja, ich möchte recht herzlich danken, dass die große Ehre, dass ich das bekommen habe. Und ich bin sehr froh, dass ich hierher gekommen bin, durch Ihre Einladung. Und dass ich hier mal gehört habe, wie hier gearbeitet wird. Und bin sehr überzeugt, dass die Offenheit, die hier herrscht, für alle Leute hier, dass es uns weiterbringt in der ganzen Therapie.
Okay, let me try to translate
Sagen
this.
Sie das alles vor, bitte.
Yeah, so I've tried to say this in German. So he thanks very much. He's very grateful for Ed to have invited him to come here. And he has already noticed that this is a very different group that is much more open than any other group of physicians that he's ever been around. And he really appreciates that. He knows that lots of creative impulses will come from this group.
Ich habe hier so viele Ärzte, Zahnärzte hier, die gearbeitet haben. Und ich bin hierher gekommen, von denen zu lernen, was es da noch gibt.
Okay.
Ja.
Okay. Even though he's been the teacher of all of us way back, he says he's watched various dentists work here, and he's been tremendously impressed about the new level of where we've been taken to it. Doug Phillips, where's Doug? Doug, raise your arm. Doug Phillips has been the personal dentist of Dr. Issels in Florida, and Doug, of course, is one of our most committed teachers in the Academy of Biological Dentistry, the Academy of Neurotherapy, and one of our leaders. And it was great that these guys met up. And Dr. Issels didn't know who he signed up with when he went to Doug for dentistry. He didn't know that he actually saw one of his students.
Ja, ich habe nicht mehr viel zu sagen, was dass ich herkomme, hier zu lernen.
Okay, he says, well, I came here to learn, so let's see what happens next. Okay.
Ja.
Okay. During one of the question and answer sessions, we will ask Dr. Issels to be up here so he can talk to us about cancer therapy, the various questions. He will be working, consulting with one of the clinics at Tijuana in Mexico that has largely adopted his methods of treatment. He will be consulting there, and hopefully we will get him to start like a smaller group of us, like in a workshop format where he lives now here in California, to work with him on an ongoing basis to learn from him. I will try to myself organize it somehow that on a periodic basis we can meet with him and extract from him as much as we can. Yeah. Okay, well, thank you. Thanks, Dr. Issels. I want to sing a song to the folks. Is that okay? I have my guitar here. Is that okay?
Yes. We're in for a real treat. Is this thing on?
It is. Yeah. A little closer to your mouth, man.
Okay. We're in for a real treat because Dietrich wants to sing us a song. This usually happens at the last session of Motel Medicine. Or neurotherapy by the room number.
Where are the earplugs that he had?
Now give him a listen, he's not bad. I just, despicably I said, well, you're nothing but a German intellectual. I was right.
So really, like, this is a deal that Carol and I have, because there's only one way to stop Ed, is by singing a song. This is a song that was written by Kate Wolf, who's one of my heroes, and it's got a nice chorus. It's called "Give Yourself to Love," and I ask all of you to sing along with it, hum with it, sing the chorus with me. Whatever. I try to be loud enough. So it's dedicated to Ed. Kind friends come gather round. There's something I would say. What brings us together here has blessed us all today. Love has made a circle that holds us all inside, where strangers are as family, loneliness can hide. So give yourself to love. If love is what you're after, open up your hearts to the tears and laughter and give yourself to love. Give yourself to love. That wasn't loud enough. Let's do the chorus one more time. Give yourself to love. Love is what you're after. Open up your heart to the tears and laughter and give yourself to love. It comes around again in a little while. Next time you see if you can turn up the volume. Remember, this is to honor our fearless leader, Ed. So sing it with the same fierceness that he has. I walk these mountains in the rain. I've learned to love the wind. I've been up before the sunrise to watch the day begin. I always knew I'd find you, though I never did know how. Like sunshine on a cloudy day, you stand before me now. So give yourself to love. If love is what you're after, open up your heart to the tears and laughter and give yourself to love. Give yourself to love. Not bad.
a seed. Love can't give you everything, but it gives you what you need. And love comes when you're ready, love comes when you're afraid. Will be your greatest teacher, the best friend you have made. So give yourself to love, love is what you're after. Open up your heart to the tears of laughter. Give yourself to love, give yourself to love. One more time. Give yourself to love, love is what you're after. Open up your heart to the tears of laughter. Give yourself to love, give yourself to love. I would say we start officially 15 minutes later than it says on the program. So we have. Oh, I see. It says 2 o'clock on there.
At 2 o'clock, Jerry Boco's going to be on, and I don't miss that.
And also, after Chris's lecture tonight, I asked Don Bartram from Australia to update us on his use of the dental laser, of using the laser to treat bone cavitation and other problems in the mouth. And so the program's going to take a little longer than it says. There's going to be one other lecture at the end of the day. And then we have the hospitality room. So just that you know for your plans, there won't be time between the little banquet or meeting in the hospitality room and the lecture. We'll straight up from here to there. Okay. Have a nice night. Olive trees.